Hello all, today we are going to talk about the topic functional capacity evaluation, that is FCE. Okay, so it is one of the physical evaluation procedure. Okay, traditionally it is one of the traditional method also. Okay, physical evaluation procedure. So in this we are going to test the uh, muscle strength and joint range of motion and radiographic findings like MRI, X-ray, CT scan. It's like radiographic findings, and also some of the functional abilities and any medical signs or symptoms. Okay, medical signs and symptoms. So these are all we are going to evaluate. Okay, so these abilities are going to impact in performance of work. Performance of work. Okay, this is what the functional capacity evaluation. Okay, IOTA, that is American Occupational Therapy Association, in 2005 they give one definition. So that is it is a systemic process of assessing the individual physical capacities and functional abilities. Physical capacities and functional abilities. This definition is given by the IOTA. So after rehabilitation, which means if the person having any injury or illness, they are going to take the medical management first, then they are going to the rehab team. Then after rehabilitation, the person may return to work or return to desired activity. Okay, if the person return to work, they need some of the capacities, some of the abilities. Okay, so for that we have to match something, that is the patient ability and the job or activity demand. So if these two are matched, then only the person can perform the work or perform the desired activity. Okay, so we can tell in another thing, we can analyze the FCE, functional capacity evaluation, as well as job analysis. So if these two are matched, then the person can perform the work. Okay, what is the purpose of FCE? Okay, first, to determine the individual ability, okay, to work safely or to work with full time or part time. So full time or part time. So we are going to determine this. Okay, if they need safety or they able to do the work safely. So timing and safety we can determine first purpose, and we can determine what are the restrictions, what are the modifications they need. Okay, and what are the accommodation that are necessary, okay, to prevent the injury or anything, to prevent complications or injury anything in the workspace. So to determining this, we using the FCE. And to determine the limitations, that is impairment limitation. Okay, so to compensate, okay, by this FCE we can understand the extent of the impairment, and we can give the compensation or adaptations. Okay, then by this FCE we can predict what rehab we can do. Okay, so for work we can do work hardening or work conditioning, so which program they are needed, like that we can predict. Okay, along with their going, so they are going work for the 1 hour, then we can do this. Okay, as a rehabilitation we can do, and they continue to develop their potential abilities. In this FCE, one of the area, that is a physical work performance evaluation style. Okay, it was developed by ergo science. Okay, so it demand that 20 physical demands. Okay, sorry, it is going to test the 20 physical demands. This physical work performance evaluation. Okay, in this 20, lifting, standing, walking, sitting, carrying, pushing, pulling, climbing, balancing, stooping, kneeling, crouching, crawling, reaching, handling, fingering, feeling, talking, hearing, seeing. These like 20 physical demands are there. Okay, so and also we have the 7 sections. Okay, 7 sections in this. That is a dynamic strength, position tolerance. Okay, what is dynamic strength? So dynamic strength is nothing but it is a moving strength. Okay, we are moving the object from the floor to waist to eye level. So lifting. Okay, floor to waist to eye level. So this like, okay, so this like we are lifting, and the unilateral carry, bilateral carry, pushing, pulling, everything comes under the dynamic strength. Okay, then second section is position tolerance. So in this the sitting. So these demands are going to be measured by these 7 sections. Okay, so everything comes inside this, but we have the categories. That's it. Okay, position tolerance. We have the sitting position, standing position, overhead work in standing, lower head work in standing, kneeling, lower head work in sitting, overhead work in supine. So squatting is like positions. Okay, we have the positions. So see, this is the overhead work in standing, this is a lower work in standing, and okay, then third section is the mobility section. Okay, so in this stair climbing, repetitive squatting, walking, crawling, ladder climbing. Okay, so these like skills are assessed. Okay, then fourth section is the fine motor section. Okay, in this the grip strength, pegboard, and dexterity test. In this we have many dexterity test: OCCUPATIONAL, NOTCE dexterity test, Minnesota dexterity test, hand tool dexterity test. This like we have. Okay, then fifth section. Okay, fifth section is the balance and coordination section. Then sixth, that is the endurance section. Okay, so balance and coordination is individual component. Okay, so totally 7. By the 7 we have check for the 36 tasks. We are evaluating 36 tasks and giving the result. Okay, so by this we can get the person can able to work 8 hours or part time, or the every demand is matched with the person ability, like that we can understand. Okay, during FCE administration we have to maintain the safety. Okay, so during evaluation we have to prevent injury. Okay, so during evaluation there should be a no injury. Okay, we have to when to stop, when to not to stop, we have to know. Okay, it may be 2-day assessment or 1-day assessment, 2-day or 1-day. So at the same time FC has some limitation. Some of the person may not project the test performance in their actual work. Okay, okay, by this we can give the result like overall level of work. Okay, tolerance for 8 hours daily work, then cooperation. Okay, the level of cooperation while testing, and any limitation to the client. Okay, is the abilities match with the job demand, and what are the intervention need for consideration. So these are all concluded in this FCE. Okay, so in this overall level of work we can do like the unable to work, able to perform sedentary life work, okay, able to perform light work, able to perform medium work, okay, able to perform heavy work. This like we can give the levels. Okay, so by this we are giving this result. Okay, but still some of the researchers are going to prove the validity and the reliability of the FCE, but still some of the limitation is also there in this FCE. Okay, okay, some person have them limitations. It may be get ocean when the evaluation, like that. Okay, okay, yes. In this video we just discussed about the FCE, that is functional capacity evaluation. In our next further videos we are going to discuss about more and more topics. Thanks for watching. Tata.